Good morning to one and all. Uh, Welcome to Healthcare Transformation Summit Day 2. And we are here with the top CEOs from various hospitals joining in. This panel we'll be discussing about how we are harnessing health. Thanks once again for each one present here. Uh, Mr. Ravinder Karanjekar, CEO Kiran Super Multi Speciality Hospital, Dr. Hiren, CEO of SL Raheja A. Fortis Associate, Dr. K.V. Venkatramana, Director Strategic Planning, Bhakti Vedanta Super Speciality Hospital, and Dr. Venkatramana, Director CEO Excel Hospitals. We'll be joined in by two other CEOs soon. I think Mr. O.P. Yadav is here. Hello, Mr. O.P. Yadav, the CEO of National
Am I
Heart.
audible now?
Yes, sir, you are. Yes. So to begin with, I would like to ask you all, healthcare spending has always been a challenge, and being a CEO is not an easy task in an hospital. So what has been the challenge for the in the past 6 months, where you're also have an uninvited guest, the pandemic, which has troubled all of us. So how you're
क्या माइक ये है
trying to
क्या है ये?
how you tackling it. I would like to hear from Dr. Karan Shekhar. Please unmute yourself, Dr. Karan. Thank you.
Yeah. Good morning, everybody. Can you hear me?
Yes, sir. Yes, sir, we
Hello,
can.
can you hear me?
Yes, sir.
Huh?
Yes, sir. Yes, sir, I
Yeah,
can.
good morning. Yeah. Last 6 months were unusually eventful. Especially, we have seen the encroachment over the personal as well as the professional area by uh, COVID-19, and which has changed our total perspective on the healthcare. Uh, Probably it has made us more disciplined. Probably it has more made us more aware how we should function in a better way. And this was an area where tremendous stress, probably unbearable stress, was there on the middle level hospital. My hospital being a little bigger hospital, we could sustain the stress of this. But having said that, it was the main challenges which we faced during March, April, May were financial challenges and manpower challenges. Because a lot of people, when they were placed on the COVID ward, or a lot of people, when they were placed into the area where the COVID OPDs were there, they left. And movement of the people was restricted. People who were not coming from nearby area, it was difficult for them to come. And having one of their colleagues getting COVID positive, they were getting frightened. Now that over the 6 months, the fright has gone. Over and above, government has played a very vital role in the whole process, but unfortunately, the coordination which was to be seen in various agencies was lacking considerably. With the result, what we were doing today, we had to change it for tomorrow. What we are doing day after tomorrow, we don't know. Whom to investigate, whom to admit, whom not to admit, whom to send to civil hospital. All rules were changing day by day. Still, it was an opportunity in disguise for all the hospitals, because those hospitals having vacant beds, they were filled up with the COVID patient, and they were getting money for that. If I say they were getting a little more money than what they were getting it previously, it won't be wrong. But now that it is weaning off, and today's news says that by 15th of September in Maharashtra and all other area also, it will start weaning off, and within a month's time, it will come back to the normalized. So in that situation, to restart will be another challenge. So these were the basic challenges, but we could cope up. We had normally on an average of 200 patients COVID admitted. Now recently it has come down to 150, 160. The issue was with the ICU patients and the intensivist availability. These two issues needed to be sorted out. We learned a lot of lessons from this, so that in future any such pandemic comes, we should be ready to treat for that. Yeah.
Thank you, sir. I would like to ask a question again because I think Mr. O.P. Yadav had missed the question. Sir, I'd posed a question for the panelists asking them, like, healthcare spending has always remained a challenge. And being a CEO, you have to strategically, spend in an hospital. And now the pandemic is there for more than around 5.5 months. So how are you tackling this, Mr. O.P. Yadav? If you can answer.
Well, certainly the clinical volumes have plummeted. We know that. Finances are stressed. We also know that. Uh, I think beseeching the government at this stage with its own socio political agenda, with the coffers absolutely empty, is not going to help matters. So we'll have to take the ball in our own court and we will have to tackle it. One thing we have done is we have tried to take out the hospitality element out of the hospital. And that's where a lot of cost saving has come in. Secondly, we have found that uh, descaling the hospital, the concept of so-called, the flexible or the collapsible walls, the terminology which McKinsey used, well, that's come a big way because certain areas which were not being used, we closed those blocks totally and concentrated into fixed areas with all specialities working from those areas rather than keeping all the areas open. Also, we have tried to address our staff by energizing them, by decentralizing decision making, and try and get them on board by giving them small targets of savings and saying, you innovate your own means and try and bring out this saving, which they have done by way of optimizing the utilization of their working hours, that who stays home and who works, by closing down lighting and industrial, the air conditioning system, and those kind of measures. And lastly, we tried our increase our revenues by two models. One is we have taken to telemedicine in a big way over the last 6 months. We were not practicing at all, and today we are giving roughly 25 to 30 telemedicine consults in cardiology alone. And secondly, we do undertake domiciliary visits of doctors if called for. So those kind of innovations will have to be introduced.
Okay. So going back to the panelists, now I would like to listen to Dr. Hiren. If you can just give your thoughts on the same. You're on mute. So Dr. Hiren, you're on mute.
I've lost my
Now we can hear you. Yeah.
yeah. Sorry. See, Dr. Karanjikar and Dr. Yadav have more or less said exactly what we have done. But to look at it, when the healthcare industry was doing quite well, in that time we were growing at a steady and pace of about 15%. At least I'm talking about our hospitals. But what happened was after the pandemic came in, then the whole thing has been set aside. It's almost like in a limbo. See, profits have been looked at in a hospital in a very bad manner. They expect the hospitals not to make money. We are a charitable trust hospital, and but we do make profits. And the reason why we need to make profits is to modernize our infrastructure, get better equipment to come in, because the profits of the earned from the hospital have to be plugged back into the hospital only. Now, what has happened is we have made significant losses in the first quarter, and that has wiped out my entire capex for the next year. So looking at it, what would happen basically is that 1 year of our progress has would be like gone. If we even close the year at the end of it with a zero EBITDA, if we are negative, we always go back. But looking ahead, what we need to do is try and maximize our yield. And like Dr. Yadav said, that the only way to do that when you can't increase your revenue is to keep a tight leash on your costs. And that is exactly what we are doing currently. And our being a single monolithic building, we have an issue about with my mine is a 150 bedded hospital, and about I have around 130 COVID patients there, and around only 20 beds for emergency non-COVID work. When that happens, people are scared to come to the hospital for non-COVID work. And now gradually we will have to shift back our focus from a COVID patient base to a non-COVID work, because that's it. Our hospital basically was a oncology and diabetic hospital, and with when we used to do a lot of charity work on pediatric cardiac surgeries. In fact, we did 200 surgeries in the last year, and now this year I don't think we'll be able to do any of this kind of work. Now that is something which we'll need to come back to. So going ahead, we will have to chalk out a plan as to how we go back into the non-COVID work era, and that would be my future challenge, and that's how it's going to be. Thank you.
Thank you. Let me go to Dr. Venkat from the Excel Hospitals. We have two Venkats, so I have to be specific. Dr. Venkat from Excel Hospitals, can you please share your thoughts on the same?
Yes. Uh, Good evening, everyone. Good morning, everyone. It's a pleasure to be in front of the eminent panelists. And thank you for inviting me to talk on this very important topic. So, very interesting, this topic, and very relevant to the community of doctors and healthcare providers. Going back a bit, traditionally, the hospital industries or the healthcare provider industries were thought that they would be immune to any downtrend in the nation's economy. But this COVID has caught everybody unaware, and we have been proven that even the hospitality or the hospital industry can be severely affected by a situation which is actually very relevant to the own industry, which is COVID. So very, very strange thing that happened and which caught everybody unaware. So now the small and medium hospitals, and in fact the larger hospitals as well, are finding it very difficult to sustain. So the normally, if you say the average EBITDA is about 12 to 18%, average 15%, the occupancy rates have plummeted to an average of about 20-25% during the lockdown period, March, April. And now it's very difficult to even return positive EBITDA at the moment for these 3 months so far. And it will be like that, which can be foreseen for the next few months till at least the end of the year, and probably the next year as well. So it's difficult times, very difficult to sustain. So we have to innovate. We have to start again gathering ourselves, and the perfect place to gather ourselves is to reflect back to see what mistakes we have done in the past, correct our mistakes, and one probably is to be more patient centric in the next few months, or carry on being more patient centric in the next many years to come. We have to innovate ourselves to do new things, to cater for population who are scared to come into the hospitals. Telemedicine and digital health is going to be taken up in a big way. Even after COVID, I think it is here to stay. Many patients will be finding it convenient. They want to avoid unnecessary infections even after COVID subsides. They want to travel less to a hospital. So things like many diabetes patients, they can be easily managed by just looking at their sugars, their blood reports. Many times, of course, surgical patients still have to go to the hospitals. That's a different issue. So that is one thing. The second thing is, after the COVID subsides, we have a vaccine and everything gets back to normal, there'll be a flood of cases. So whatever deficiencies we are facing at the moment in terms of lack of patients, lack of occupancy, etc., that is going to be overcompensated from probably the next year summertime onwards. So that also has to be in the back of the mind, how to deal with those patients, whether we develop the infrastructure, whether we develop the manpower that is needed to combat all these, because a lot of cases, including malignancies, etc., they are not being able to diagnose, they are not being able to have appropriate treatment at an appropriate time, so they are all burning in the background. So these are the things which I can think of at the moment. Thank you.
Okay. Summarized so well. Thanks, Dr. Venkat. Now I'm going to Dr. Venkat Ramanan. If you could just give us your thoughts and the pointers, which the difficulties you have faced in the last few months. Yes.
Good afternoon to everyone. And it has been very, very heartening to hear from all of you about your thoughts, which is more or less the same for me as well. You see, when this pandemic started, we had a meeting with all our staff, and we first attended to their requirements to ensure their safety is taken care. Then what we did is we went and met the municipal commissioner and involved him in the process of how to take care of this pandemic situation, because government has invested in a 200-bed facility in Mirabainder. It's one of the class hospitals, but unfortunately it was not used. So naturally, the local public are not going to go over there, and the regular hospitals like us who are also treating regular patients are also facing such kind of difficulties. So what we did is we put in our own staff, doctors, everyone, to ensure that 200-bed hospital is fully functional, including a 20-bed ICU. It came up as a case study that within 10 days, the 20-bed ICU was in fully functional, and the political parties as well as the commissioner were very, very happy about that. Until date, probably about 4,000 plus patients have been treated. Then once that thing was handled, what we did was the government started asking us to make a dedicated COVID hospital in our own facility. We have a 200-bed facility, but then we also have about 3 major other hospitals in one in Mirabainder, another one in Vasai, which is in about 2 acres of land. So what we did is we started creating one hospital as a dedicated COVID hospital, and we created about 70 or 80 beds over there. But we had to do lots of investments because we were not prepared to have a ICU kind of setup in that facility. So everything had gone in, and it is the main challenge was to get the staff from as far as Palghar and this side from Dadar. So this has been a great challenge for us. Somehow or other we have been able to motivate them constantly and keep get into the habit of taking decisions based on head, heart, and hands. And most of the time, the employees have come forward to cooperate, and including our physicians, irrespective of whatever is the faculty, we try to allocate them in different areas. So the basic factors have been taken care. During the initial 2 months, more than 80 plus deliveries on emergencies had to be attended, more than 30 or 40 ortho and other surgeries have to be done. And slowly we have started creating the confidence, removing the fear amongst the public that the hospital is still a safe environment for you to come and get treated. And most of our on a regular time, our OPD is about 1,200 per day, and which had really come down to 200. Now it has started slowly picking up because the transport system and the public transport has started to some extent, and we are now reaching about 400 plus. And on the other side, we closed down the peripheral units to the minimal extent so that we were able to consolidate on our finances. Yes, we took the help of all our staff. There is a kind of contribution from each and every staff and the doctors to ensure that in case any of our staff and their family members are affected by COVID, we assured them, irrespective of whether they have insurance, and some of them who do not have insurance, we will take care of them. So these things have helped them to build the confidence amongst the staff. And we also started the online consultation and home delivery of medicines and home
Okay.
care service. Unfortunately, we have been conducting last year close up about 700 free camps to the community, which has now come down to a basic standstill. So we are still in a fix how to go ahead with it. Thank you.
Okay. Thank you, doctor. So, yes, as each one of you has pointed out, like, there is a revenue hit in the past 6 months. What are your expectations, like the private sector's expectations from the government? Do you think an economic rescue package will help you all? What kind of, kind of things you expect from the policymakers to continuity of business beyond COVID-19? How this is going to happen, Dr. Karanjekar? Your views, please. So you have to unmute yourself. Panelists, please unmute yourself. Yeah, when you answer. Yeah. Yes, we can hear
Yeah,
you.
okay. Any rescue package from the government is welcome. But major thing which we would like from government is the proper flow of orders coming from the municipal commissioner or from the government or from the health secretary. That is one thing. Second thing, we would like that the people who are getting admitted into the private hospitals not getting the kind of medicines which are required there for ICU, which government should provide at the concessional cost. Third, government should stop threatening us and rather collaborating with doctors, saying that they together we can push off this challenge. In this situation, there are PPE kits. In this situation, there are medicines. In this situation, there are manpower planning where the people have left or joined. In this situation, there is a transportation issue for the staff which is coming from away. In this situation, there is an accommodation problem in some of the hospitals. My hospital is a big hospital. So I had a 650-bed hospital, so I could accommodate 100 people, 7 days staff. After 7 days, you change the whole staff and rooms. That we could do it. It was so big that half the part we kept for COVID, half we kept for normal. So in normal area also, in last month we did about 300 major surgeries, neuro, onco and other. But everybody it is not possible. In that case, they have to support it. And the last thing is that whatever government promises, we know government is under stress across 131.3 billion people across the country. But at the same time, if they promise something in terms financially or otherwise, they should fulfill immediately. As it is, there are low revenues. As it is, there is a problem in paying the staff. As it is, staff is asking for more money. If they are in, we pay 1.5 times to the COVID ward, and if they do 12 hours duty, another 1.5 times. You have to pay more for them. In this situation, at least the due money, that is per bed 10,000, 18,000, 20,000, or whatever it is, that should come very easily without asking. It should be within 7, because tomorrow I am not going to purchase anything if I don't get the money. From where I get
Okay.
the money? So that is the main thing. Rescue package will always help us. Yeah.
Okay, so thanks. Yeah. I would like to quickly go to Dr. Venkat Ramana on this because he was talking about a lot of things which are in the revenue cycle. He had pointed out earlier also. He had summarized it. So, Dr. Venkat, Excel Hospitals, please.
Yes, thank you. Yeah, I completely agree with Dr. Karanjekar on this. Government should look into the difficulties that are happening with the healthcare industry. They should provide short-term relief measures to improve the cash flow to the hospitals. Measures like decreasing TDS, for example, to clear immediate dues, ESI, CGHS payments. They should have incentives like subsidies in power tariff that we are facing. So we are all incurring more expenditure to stick to government norms. So it is only fair to say that the government should support in this big venture, which is affecting millions and millions of the population that we are all having. So also they should give us priority sector status. People who are going for loans, they should be provided with easy loans with reduced interest rates, for example. So these are the things which I can think of. And also there is a big push from the government for digital healthcare, and I appreciate that the government has done quite a bit in terms of Supreme Court norms that have come for telemedicine, etc., and the National Digital Blueprint, which has been fast tracked nowadays. So government should also work with the private sector to ensure that a universal digital healthcare platform is established, which works seamlessly with hospitals across the nation and in the patient's best interest. So that is what I would like to say. Thank you.
Yeah. Quickly to Mr. O.P. Yadav on this. Uh, Mr. O.P. Yadav, your views. You're on mute. You have to unmute yourself.
I do agree with all that has been said. We tax benefits, we need fixed cost subsidies. All that is given. In fact, FICCI, Ernest Young conducted a study and they published we need an immediate infusion of something between 14,000 to 24,000 crores. This is a beautiful study from them. But then we must also realize that the government has depleted financial resources and the systems are not permitting. They have this socio-political agenda, as I started in my opening comment. Money has to go even for things like Ram Mandir and developing the Central Vista in Delhi. So, having said that, I must also acknowledge that the government has cleared the dues. They have released, at least in Delhi, all our pending CGHS payments have been released. All our income tax dues have been released. So, giving the due to the devil. But the 3 points that I want to add on very, very specifically are: one, the governmental attitude has to change towards private-public partnership. And I just don't know why government treats profit as such a harakiri word that you just won't touch it with the barge pole. I mean, a legitimate ethical profit is desirable and you just cannot work for no profit. So that is one thing they have to realize. Even the government department should begin to make some 5-10% profit. So that is a change of mindset. Second, I would say is that they should do some regulatory relaxation. I don't know what made them issue guidelines in which, for example, recycling of the catheters for angiography procedures was not allowed. Now that's most ridiculous. We in this country, in fact, for the entire world, we need to recycle everything, recycle in a proper way, and there are proper ways. If we do an ETO, there is no problem. So they should regulate us using our outcomes, but not over-regulate us based on, you will not do this and you will not recycle. Nodal officers are being appointed. They are being asked to be given separate rooms with phones, with cell phone, with fax. They're adding to the cost and wasting our thing and putting, very punitive charges, 10,000 per bed for COVID patients. I mean, that's ridiculous. So I think they need to down-regulate a bit and accept PP as a wonderful model.
Thank you, Mr. Yadav. Dr. K. Venkatraman, your thoughts on this?
I fully appreciate that we have to all of us come together and ensure that the economic package from the government is released for the healthcare. Sooner or later, government is going to infuse funds into the airline industry, which has come to a standstill. Similar to that, they should infuse liquidity into the healthcare setup. It can be in the form of short-term interest-free loans, to bail smaller organizations out, zero rating of GST, duty exemption on for the imports of the medicines, basically direct tax, indirect tax exemption, and as our Dr. Venkat was mentioning, rebate in the form of power tariff has to be done, and also government subsidy in terms of moratorium on working capital and loans are required. Say, for example, currently we are constructing a 112,000 square feet of a new building with 8 floors and 2 basements. And now suddenly everything has come to a standstill. This cannot, because this will create a kind of disruption in the working as well as in our capacity building. So now we have to ensure that the government is looking at the healthcare institutions as facilitators to the performance of the government in a better way. Otherwise, it's like looking at hospitals and capping the prices is not at all recommended, because everybody, the costs are differing from different states to state. For example, Tamil Nadu has conducted a study along with some of the doctors from the government and outside, and they fixed the rate that it is going to cost almost about 2,25,000 for 10 days of stay for the COVID patients, and then if they are in ICU, it will be about 3.5 lakhs. But here in Maharashtra, they have brought it to the tune of 5,000, 6,000 rupees per day, which is a ridiculous kind of figure. Without understanding the ground realities, they expect a violin sound to come out of the flute. That is the kind of situation we are in. And people who are decision makers have no idea about how a medical institution functions. I'm really sorry to say that.
Okay. So, going back to Mr. Hiren, your thoughts, Dr. Hiren, if you can unmute just, yeah.
Basically, if you see the health subject is a state subject, so every state has a different rule. Unfortunately, in Maharashtra, we are at the wrong end of the stick because we are having a capping on 80% of our beds, and those 80% are also at a rate which is by far, I think, the lowest in the entire country. Now, what we would request is from the government to, if you are capping 80% of my capacity at your rate, give me a 80 relief of 80% in my electricity bills, in my water bills, and in my property taxes. That's all which we ask. Even if you give me that, that would take care of a majority of my losses, and we can continue doing the work as the government wants. Our trustees have been very clear about it, that we have to stand with the government when, because the society needs us now in this pandemic, and we are going to do that. But if you expect 80% of my beds to be capped, give me a 80% rebate in my electricity bill, in my water bill, and in my property taxes. I don't want money from you. Just give me a rebate on those. And if possible, give me a interest-free working capital, capital, because that is something we are struggling now to even pay our salaries, to pay the vendors in time, because our money is stuck. The insurance companies are not paying within the stipulated time. So that is causing a lot of pressure on our working capital. Now, this is something, if the government gives us interest-free working capital, that also would go a long way in getting us back on our track. And we will be there with the government.
Yeah. So now you have given your opinions on what the government should do. So in the past 6 months, how patient-centric was each one of your hospitals? Like, how was the whole thing managed, and what are the things which you had given an extra push on, extra effort which has been done by your hospital, even when you were in a financial strain? One or two points, and also I would like to ask you all. Two different things. This is one, and second one, I would like to ask you, like, how has your role as a CEO has changed, in the 6 months, because pandemic is there, so everyone are putting, extra efforts in each hospital. So if you can just collate your thoughts on these 2 points and help me giving the answer, I would like to ask Mr. OP Yadav.
See, one thing is we have changed our protocols, clinical protocols. For example, After an open heart surgery, an average patient would have 3 Xs on day 0. We reduced it to 1. We used to do 1 hourly blood gases. We reduced it to 1 immediately on receiving the patient, 1 6 hours later. So change your clinical protocols. Then fast tracking of patients so that they stay less in the hospital. So those kind of change of protocols, clinical protocols, was very important. The second thing I think is, as a CEO, relegation of work and getting the confidence back. I noticed that there was a kind of desperation of people, a dejection, a kind of uncertainty of future, and half of it driven by the media and by the poor response from the government. Every day, morning and evening, orders being changed and rechanged. So one was to get across to the staff and to talk to them, get them and galvanize them, and let them take decisions by decentralizing, asking them to do small tasks between themselves. And that really worked very well for us.
So, Dr. Karanjekar, your thoughts, please. Dr. Karanjekar, your mic is on mute.
Yeah. As Dr. Yadav said that yes, we had to change our protocols, modify it for the situation which we are dealing with. Having said that right from the day one, see, we when it started somewhere around 7th of March or 6th of March in Gujarat, I had in Gujarat hospital also. So there we decided that for some point of time, as the cases were going to civil hospital Surat and municipal hospital, we will continue treating non-COVID patients. So we did a lot of work in non-COVID area. People knew that not COVID work is done here. COVID patients are going somewhere else. During this time, one thing we did that we created COVID wards, ICU and COVID wards, COVID rooms, complete floors, and where voluntarily we asked the staff to work there. Initial there was a fear because the kind of fear psychosis which is created by media and lot of WhatsApp messages was so high that initially very few people were willing to work there. But as they saw that people are working and happily they are coming back, going home, everything happening, number increased so much so that now this COVID ward number of employees is much more than what is we require. This was one step. Second step was creating an fever OPD where every patient with the slightest symptom and where we had criteria of selecting the patient which will go to non-COVID area or COVID area. Telemedicine part, teleconsultation part was immediately instituted. In fact, we have given special mobile to each consultant, and his number was circulated across the city. And if you have any consultation, you can have a video or audio call with that doctor in that specialty. We spent about 30 or 35 mobiles for this purpose. After that, we saw to it that the patients which are treated in the ward, we have a 12-hour shift with a 6-hour bio break. So after 6 hours, you have half an hour, people eat there. And on the same floor, we made arrangements for the staff to stay. So donning off and on was done there itself, and then they went to the room, provided all facilities for them, including entertainment. And after 7 days, second batch came. So one batch was there for 7 days for 12-hour duty. That went off for next 7 days, and another batch came. So this came continuously. We are proud to say that almost nil rate of staff getting COVID. Almost nil rate. Maybe one or two nurses, that is all. And we saw to it that patient gets benefited from this. At the same time, non-COVID area was working. As I said, we did 300 surgeries. It was working, continued to work, and we made it an emphasis on the people saying that non-COVID area is absolutely separate and where they can come and have the treatment. This helped us to continue our work to 60%, 70% level, and government money which was coming for this patient cross subsidized with the non-paying patient. And as a CEO, Myself and my assistant job was to motivate the people and see that the systems work. It is not on paper. The implementation of these systems was extremely important at every patient because you were changing the flow of activity which people were habituated to do previously. So now to change that, we have to see that we have to monitor it and implement it properly. That was as a CEO as a job. P&L taken care of, and so now we are on line absolutely.
Thank you, Dr. Karanjekar. I would quickly go to Dr. Hiren. How do you see this, the patient-centric things which you have done in your hospital, plus, as a CEO, what kind of role change you have seen in past 6 months? If you could just.
Like I said earlier, the whole thing started with us having laid down strict protocols for COVID work. Because since we have a single building, I had to be very careful in segregating the passage of patients for COVID and non-COVID. We made separate entrances, separate pathways, almost like a green zone for people who are going in for COVID. People who are going in for non-COVID work could not even accidentally go on the COVID floors. All those things were made. But my main role as the CEO, that whole thing was to counsel. I made an effort to talk to each and every group of the hospital individually. I spoke to the front office people separately. I spoke to the security guys separately. I spoke to my nurses, my housekeeping guys, my doctors, my RMOs, my senior consultants, all in a separate group, one-on-one basis also. That is because everyone had a different fear. See, the problems which the fears which the doctors face were very different from the fears which a front office guy or a security guard faced. So, and once they came, they had the access, and I made my office an open office. I said anyone who has any question can come and meet me and talk to me directly. So that gave a lot of confidence in the staff to come and work in the COVID hospital. And the second thing which we made, and we made it a public disclosure here, that was no staff member or the family members, if they get infected, would be turned away from the hospital for treatment. And all of we have taken care of each and every of our staff member and their family members when they have got infected. The fear for the staff was not for themselves. The fear for the staff was, what if I carry my infection home? What if my mother gets infected? In Mumbai, everyone has got small homes. You either have aged parents with you or you have small children staying with you. Everyone had a fear. What if I carry my infection home? What if I infect my parents? What if I infect my children, my wife? How will we take care of them? Because the costs are very high. So we made a policy decision here. Each and every worker in the hospital would get free medical care if any one of them has this infection. That allowed them to work, fearlessly for COVID. That was something. So my main basic role as a CEO, which I saw, was more of a personal contact. I made an effort to talk to every of my employee individually, and that has made a lot of difference in the way our hospital is functioning today. Thank you.
Thanks, Dr. Hiren. I've seen Dr. KV from Bhakti Vedanta noting down a lot of points, so I want to know what he has noted down. Let's listen to him.
It's quite an interesting discussion, and happy to learn a lot of personal approach to be with our staff and doctors. Thank you, Dr. Hiran, for sharing that. And what we did is, first and the foremost, was to ensure that we stood with our staff and the doctors and their families. We have a very unique kind of department in the hospital. It's called the Department of Spiritual Care, because our concept is treatment for the body, mind, and soul as well. And the counselors started talking to all the family members of the staff, and also the admitted patients. They used to do telephonic counseling as well. And a lot of confidence building exercise happened. And as Jack Welch of GE used to do the concept of management by walking around. So we ensured that we divided our responsibilities and ensured that we go around to all the places, interact with the staff at the floor. So that gave them a lot of confidence. And as Dr. Hiren was mentioning, we gave them the assurance that in case you are affected by COVID, we will take care of you, not only you and also their families. So these things were really helping us. And we also initiated ours is a US FDA approved research facility as well, and NABH facility. So we have initiated certain research projects as well. One thing is based on the cough sampling, how AI based kind of things can happen and how we can correlate it. It may take little more time to get it with some kind of conclusion. We are working with another major organization. And also we started working on the cow products, how by giving and using it, the duration of their stay is able to come down. And also we introduced novel policies, like if a patient who is admitted in the COVID ward is our birthday or anniversary is there, we try to go and wish them and try to greet them, spend few minutes with them, praying on them with them personally for their welfare. And there is a big video that came out of the hospital where we managed more than 3,000 plus patients. And it's like everyone who is getting out of the hospital is going with a beaming smile. You know, unfortunately, in the healthcare, we have somehow or other lost the personal touch with the patients. That we revived it. And also one more interesting factor was we integrated all the medical fraternity in Mira Bhayandar, because all of us are working with the same motive, but some of us are in the kind of in isolation. Rather get all of them together, so the united we stand. That kind of approach has definitely helped the medical fraternity as well as the patients. Thank you.
Dr. Venkat, if you could just tell us what was the patient-centric initiatives you have taken, and as a CEO, what kind of role change you have seen in 6 months, and would you like to continue the same? If you could just tell us your point.
Sure. So the first job that was there with me to tackle was I had to ensure the safety of my staff. And when I say safety of my staff, that includes not only the staff, but also automatically it includes the patients who are coming in as well. So I still remember the first day of when the lockdown was announced, my staff were very scared. They did not know how things were progressing. They were asking me basic questions like whether I'm going to survive or whether I'm going to die. These kind of questions were there. And I think most of the panel members also had similar situation to face. So the first thing I had to do is to get them all together and train them regarding the practice of taking care. Basic things like hand washing for 20 seconds with soap and water, and then followed by sanitization. Then the spaces, we cleared all the parking lot and cleared, made space specifically for patients waiting area. So we had to ensure at least 6 feet distance between the patients. We had to cancel all the electives. We were only taking in emergencies. So these are the changes that we used to do. And in our hospital, we also do consulting with the UK NHS, because I was an NHS consultant for 20 years before I moved back to India. So the UK NHS had patients approximately 6 weeks before we started getting our own COVID patients in India. So this was giving me a kind of an insight regarding where we are progressing, what is the intensity, when is the peak level, etc. So I could kind of predict the way things were going to move. So we had a little bit of more time, I would say. That's a good thing that we had, is to prepare ourselves to ensure that the safety is maintained. Second thing is, as a CEO, I found a challenge that I had to maintain the motivation of my staff. So it's a very difficult, very unusual situation, warlike situation, if I may say so, especially in the initial days of lockdown. People were very scared. So motivating our staff to come to the hospital in this situation, wearing all the PPE, taking all the precautions, treating patients, was an extreme thing for my staff to do, which I'm happy to say that they all, were very cooperative in that sense. And till now, touch wood, not even a single case of COVID positive within our staff happened because of all these precautions that I took. So hopefully, in the next few weeks, I think we should reach the peak, and the cases in the country should come down by the next month, is what I can say in my own personal experience. Thank you.
Hope, hope so. We all want that to happen. We have 10 minutes time, so I would like to ask one more question to all the panelists here. So I would like to ask you all now, in the 74th Independence Day, the Prime Minister has started this initiative, National Digital Health Mission has been launched, and we are seeing teleconsultation, norms being relaxed, and I just wanted to hear from you all how much of digital health spending will happen in coming forth months, not immediately, but in 1 or 2 years, and how it's going to help us, reaching out to rural areas, or going out to tier 2 or tier 3 cities, your hospitals, like if you have some initiatives like that, how it's going to be like digital healthcare spending, if you could comment on that, Dr. OP Yadav, if you can answer this first.
Well, we already had this platform. We had a PPP model arrangement with Government of Uttarakhand, and we run the cardiac care center in the base hospital in the Kumaon Himalayas in Almora. And we have three remote areas in Pithoragarh, Almora, and an adjacent district. So the hub and spoke model kind of a telemedicine program is going, and believe me, telemedicine program does not require a great amount of capital infusion. It's a relatively, because free ISDN lines are given by ISRO for these purposes. There is no cost at all to that, and the level of communication need not be that you have to get the PACS system. You are going to transmit some angiography pictures. Pictures we are transmitting are simple images of the individual patient. We are transmitting ECG and X-ray and a two-way audiovisual communication. And that kind of a telemedicine is very basic, requires no capital infusion, and it has been working for us. As far as our COVID response, where we started telemedicine program for our cardiology patients in Delhi and the neighboring states itself, we never had that program. And during the last 3-4 months, we have, kind of scaled it up. And today we get doing roughly 30 to 35 teleconsults per day, which is not bad for a small hospital like us. And that's the way to go forward.
Okay. Dr. Hiren, if you could just add on to it. You're on mute. Dr. Hiren, you're on mute.
One good thing I would say has come out from this COVID crisis is this telemedicine. Now, up till now, the doctors were a little skeptical about telemedicine because there were some Supreme Court and Consumer Court orders which said that, if you have not examined the patient personally, you can't treat that patient. Now that telemedicine has started, many of our consultants have taken to telemedicine like fish to water. Like the same consultants who were very reluctant to do it initially were now forced to do it because the patients were a little worried about coming to a hospital to get an infection. So now, once they have started doing that, I think that's the way forward. Now, once teleconsultation starts, telemedicine starts, you have practically broken down the geographical barriers. Now, people even in the tier 2 cities, or even villages can have access to senior consultants where they don't have to travel. See, tomorrow, if someone has got a cancer or has got some difficult disease and wants a second opinion, he doesn't need to travel now. He can do it on a tele or a video consult. And that now the same consultants which were wary of doing it earlier are now happy to do it. So this is going to help India to a great extent. So I feel the next step, and which all hospitals are currently doing, is increasing their spend on digital healthcare and digitalization of their systems. Now, that is somewhere where I think the government should help us, especially hospitals who are having a financial crunch to do it. But I think that's the way ahead. Thank you.
Thank you. Dr. Katie from Bhakti Vedanta, if you could tell us.
You see, in each and every crisis, what can we learn from this is a very, very important aspect to this. And this telemedicine is going to take a great shape. It's a learning curve for most of us, and because in the rural and tribal areas, still there is a connectivity issues. We have about 8 to 9 hospitals in the peripheral setup at about 100 kilometers. So what we have now started doing is the teleconsultation is happening, but in case they would like to see a physician or anyone personally, then they go into these satellite centers. So these two are happening simultaneously. And in addition to telemedicine, we are also focusing on creating home care facilities, because sooner or later the patients, they do not want to come to a hospital immediately. It is going to gradually happen. So why not we provide a kind of clinics, doorstep clinics. That's what another concept that we are making. And doorstep clinics or the mobile clinics will also have the digital platform which will help them to connect with the base hospital as well.
Thank you. Dr. Venkat from Excel, if you could add on.
Yes.
The digital health
My
spending.
hospital, we were working with UK NHS and doing teleradiology since more than 2 years now. So pre-COVID as well. So it is well established. But now what I feel is with the COVID situation, the adoption for using digital platforms will exponentially increase across the healthcare systems in our country. Uh, and as an example, I quote the work from my colleagues at ISB and the Max Institute of Healthcare, which they did even before COVID, that is the beginning of the year. They said that telemedicine or telehealth, if appropriately used, can increase the hospital revenue by 30% in terms of more footfall, more network of patients. Whether they come in or whether they prefer tele is up to the clinical situation and up to the patients, of course. But overall, it is going to increase the benefit for both the hospitals and the patients. So that has been well established. Only thing is the adoption, the uptake, the comfort levels for the doctors, for the healthcare providers, and the technology to be provided for this to happen. That will be taking some time, but hopefully with the COVID situation, even that will be massively increased, in my opinion. So future is certainly digital, and one good thing that the government is doing, in spite of the cash-strapped situation, is that they are rapidly expanding the national digital blueprint, and hopefully it should come out in a way which is conducive for both the private hospital sectors as well as for the patients. So patients should also be equally active to embrace the whole situation. That is when our healthcare in our country is going to get better. Thank you.
Dr. Karanjekar, your views on digital health spending in your hospital and how NDHM is going to help. Your mic is on mute. Dr. Karan, your mic is.
Yeah, I'll be very short. One, the patient psyche has to change. It is going to change gradually, but the face-to-face doctor treatment or face-to-face doctor consultation, that kind of psyche which was there for a number of years, need to change, and they can see them, see the patient and doctor each other on the screen. Second thing, this is the bubble. I'm a little different opinion from my other colleague doctors. This is a bubble used mainly for the purpose of video conferencing rather than anything else. I can see I have a patient right now which was being treated by the task force from Mumbai to Surat. They everyday contact, but this is mainly for the consultation at a primary level and mainly for the purpose of second opinion when the patient is in ICU or otherwise. It has hardly any role in terms of surgical patients or surgeries, AI when get introduced into this, probably it will be much more better than that. But introducing AI into this will definitely help us at a long way after some time, not today. But of course, everybody is talking of digital health, everybody is talking of video conferencing, telemedicine, but it is not the answer to the present situation right now. It is a helpful tool for us to go ahead till it comes to its full form.
Thanks a lot, Dr. Karan. Thanks to all the panelists. We are dot at 12:30. I think we had discussed a lot of things, and your viewpoints in each question was, it was really good and rounded. Thanks for it. We will get connected soon for the second edition of Healthcare Transformation Summit with you all. Thanks for your time once again. Thank you.
Thank you, Dr.
We are,
Yadav, Dr.
Thank
we are
you.
Venkat
also
too,
giving a
and
certificate of
of course,
participation.
yeah.
We are
And
also giving
Hiren,
a
thank you.
certificate of participation.
Thank you. Thank you.
Dr.
I
Hiren.
thank ELETS Healthcare
So,
and Mr.
Dr.
Ravi Gupta for conducting these very well organized seminars. This will really help the healthcare in our country.
Ravi is an expert in that.
Yes.
Ravi is expert in that actually.
Thank you. This is a certificate of participation to all the panelists present over here. Thanks a lot. Thank you.
Thank you so
Thank
much.